Good afternoon, everybody. It's 12:30 on a Monday. Dr. Jennings in the house. It's good to have him along. How you doing?
I am living the dream, my friend. Doing what I love and calling it work.
That's it. Now, if you love what you do, you never have work any day.
That's right.
Sometimes it's work, though, right?
Sometimes it is work. And I'm hoping to not work very hard this future here, but it seems like maybe I'm going to have to start working hard again.
All right, yeah. So people are asking questions, wondering what's going on, why this, why that. We thought the doctor would come in and tell us and maybe clue us in on what all's going on with COVID-19, because that's what everybody wants to know about.
No, and boy, I would love to be here talking about any topic except COVID.
Yeah,
but
baseball.
Unfortunately,
you want to talk baseball?
We talk
anything?
baseball. We talk my Labor Day party. We can talk about
right.
anything, but anything but COVID. But unfortunately, we do have this thing sitting in front of us, and we are seeing an uptick. And as much as we talk about the Delta variant and kind of what's going on, as we look to our west, our folks in Missouri and the Metro East are really starting to see some very high numbers. And as part of our health system and even neighboring health systems, seeing more people in the hospital, younger people in the hospital. Which is sad,
yes.
And unfortunately seeing some of those that are having a terrible course with it. This particular strain, so back when we first started talking about this, you remember we talked about kind of how many people one person can infect. Mm-hmm. And back then it was, the R0 value, the R naught value, whatever you want to talk about, was like 2 or 3. So one person would go out and they'd potentially infect 2 or 3. This one's a 4 or a 5, so it's very, very contagious, which is not good. Which is why we're seeing it, kind of take over very quickly. But the great news is that the vaccinated population seems to be very well protected. And although we have seen breakthrough cases, there's no doubt we've seen folks that pop up with it even after vaccine, but they don't get very sick.
Okay.
And, and that's the name of the game. I mean, at the end of the day, I just don't want to die.
Exactly.
And I'd like to stay out of the hospital as much as I love the place. I'd like to stay on the right side of the bed, and so if you can stay out of the hospital and not die from it, the vaccine's really the ticket, because clearly this outbreak is wildly disproportionately affecting the unvaccinated population, which is why the elderly folks are doing great. The 65 and up population, even in Effingham County, has
what's the percentage like?
75% of our 65 and up population are vaccinated, so they're doing great. Overall, we're right around the 30s, and our surrounding counties kind of range between the upper to mid 20s to mid 30s. So fairly low. Everybody talk about herd immunity, the goal to get to herd immunity.
Right.
Well, so that goal is more about 80. And
30,
and even
80,
30 and 80 is a little ways away. I mean,
Yeah.
I tried to talk my wife that $80 and $30 is the same thing, and she didn't believe me.
She's a smart lady. She knows that's not right.
But even with people that had the disease, we still have a big gap there, and so we got a huge opportunity to get folks vaccinated.
Kind of explain, we got the new Delta variant.
Yeah.
How did that evolve from that? Could I have no. I'm a radio guy. How does something change, mutate like a virus? How does that do that?
Well, that's a great question, and it's part of why getting vaccinated becomes so important. So if a virus invades your body, it goes into your cell and takes over that cell and makes it its little own manufacturing plant, basically. So it says, you're going to now produce this virus. And just like any other manufacturing plant, I don't care if you're a local industry or whatever, if you're making widgets, you create widgets. And every so often you have a defect. Well, that defect might mean that the product is a piece of junk, or it might mean the product is even better than what you've been making. Well, in this particular case, we got Post-it notes where, the plan was not to invent Post-it notes originally. Some of these inventions that happen by accident are exactly what happened with the Delta variant, is that as the virus took over in people's body and it had a fair number of defects, just as it goes, One of them came out that was better, faster, stronger than the original virus, and so now it takes over, which is why vaccination becomes even more important, because the best way to stop it is to stop production. If you stop production of the virus by vaccinating, then you'll reduce the chance that it'll mutate again, because we're still sitting with the ability that, the next virus, the next mutation could be nothing, and it just helps us and it goes away, or the next one could be worse, and here we go. So the sooner we stop production, the sooner that we'll be able to get this thing eradicated.
All right. So thanks for that. That kind of cleared it up.
Yeah.
A lot of people probably wondering how these things do that. We had it.
No,
and we
completely.
thought it was going away, but now another one came back. And
look at all those accidental inventions that are out there that people talk about, and that's exactly what happens here. The virus just reproduces, and every so often it'll spin off one that's worse than the first one.
And that's not a good thing. All right, so we know what we're dealing with. What should people be doing right now? Say, if you're vaccinated, let's start with the people who are already vaccinated. What should we be doing?
Well, thank them.
Okay, good start.
First, thank them for getting vaccinated to protect us and their families, etc. But if you're vaccinated, really, again, the likelihood of, even if you get reinfected, of getting seriously ill is small. I'm not going to say that life should be completely normal. I still think, long before COVID came around, more attention to hand sanitation should have happened to begin with. I said, I've been on you guys' show, et cetera, and talked about my grandma for years. Wash your hands, wash your face before you eat.
Yes.
So continue to use those good behaviors. I think that when you're in a social situation where you're unsure of who's vaccinated, who's not, and in a close environment, indoors especially, it gets tricky, and it's a personal decision about your need to wear a mask to potentially protect yourself. Certainly, if you're one of those folks that suffers from an immune situation or a chronic illness, just doing anything, even before COVID came around, to prevent the likelihood of you getting sick is a good thing.
Okay.
So use your good judgment. I think things like the fair that are coming up, and great outdoor event, and hopefully be an opportunity for us to have a little bit of normalcy is a really good example of exactly why we need to get vaccinated, so that we can get back to doing those things and enjoying life, and not worry that by doing so we're going to harm someone else.
All right, so you know what to do there. Okay, so if you're not vaccinated, what should you be doing?
Well, one, get in line.
Okay. Pick a number, right?
Well, actually, you don't even have a line anymore.
That's right. Just walk in and go.
Great. I mean, you can go to any of the pharmacies, many doctors' offices. The health departments have still done an incredible job. The yeoman effort by the health departments has been amazing. But number one, get vaccinated. There's so many people now, 200, 300 million doses given in the United States alone, with an incredibly low incidence of any type of significant side effect whatsoever. So please, number one, get vaccinated. If for some strange reason you cannot, then you need to really double down on your mindfulness around social distancing, masking. There's no doubt masking worked. I mean, look what happened to flu.
Mm-hmm. Yeah.
It went away.
Yeah, it's like disappeared flu.
Yeah,
you never thought you would see that, did you?
It just went away. And that, this year, now we're dealing with respiratory syncytial virus, which is kind of a respiratory virus. We got a lot of parainfluenza right now. So we have all these weird viruses that they're not necessarily weird, but they're viruses that we normally see kind of in the wintertime. And because everybody was masking, we're seeing them pop up now.
We didn't have them back then.
We didn't have it. And so now they're popping up, and it's just funny to see that actually there's no doubt to me that masking did work. And I do think attention to hand hygiene made a difference. And accessibility to sanitizer and those types of things. I mean, there's no doubt that a lot of what we pass around is hand to mouth.
All right. How about if somebody is scared to take the virus?
Well, I'd encourage you to talk to
the
vaccine. I'd encourage them to talk to their provider. I definitely would, their physician or their nurse practitioner or PA, whatever. Talk to them about what their specific concerns are. This one is different. At least the Moderna and the Pfizer vaccine is different technology, which seems to be bearing out very favorably with the fact that, that it's not egg-based. It doesn't have any of the usual things that people react to allergic-wise, and really has had a very nice side effect profile. J&J got a little publicity, of course, around their vaccine, and most recently with the Guillain-Barré Association. Again, but Guillain-Barré has been an association that we've known with like the flu vaccine for many years, and that technology is similar to what the J&J vaccine is, but very different from the other two. So the good news is you got choices.
Okay.
And so there should be something you could talk to with your healthcare provider and hopefully be able to find a solution no matter what your situation.
All right. So if you got questions, there's a lot of places to go. Do you guys have information on the website for the hospital and stuff?
We do, and to get to the health department, and like I said, really, I think I was in Walmart Sunday morning, which I shop at 7 a.m. I shouldn't have told that. Now I'm gonna have people like they're ambushing me to ask questions, but I go Sunday at 7 a.m. and I think the PA system said 7 times, line up for your COVID vaccine.
Okay.
We've got it. It's immediately available. No appointment necessary. I know the other pharmacies are doing the same thing. So
plus it's free.
And it's free. And vaccine accessibility is no longer a barrier. When this first rolled out,
sure,
it was tough to find one.
It took me a while. It took me a month or two to get it, because of, I wasn't quite old enough to get it. And finally, I got it. So, but
did you finally get old enough, or the vaccine became available?
No, the vaccine got to me before I got old enough. But luckily, and my own personal experience, I didn't have any side effects. My arm hurt the first one. Second one I got, I didn't even know I got it. Never did get sick, nor nothing. So, it's.
I had a little the floozy kind of feeling, but 24
here.
hours, and certainly beats the daylights out of days out of work and exposing my grandparents and my children. Of course, my children are old now, and I don't have any grandchildren. So but grandchildren, et cetera. So getting vaccine is not just about you; it's about protecting others.
All right, very good. Well, thank you for coming in.
Yeah.
Anything else you want to touch on?
Man, I don't think, other than Boyd, let's finally put this thing into the history book.
That would be nice.
And help us to do that by getting vaccinated.
Thank you very much for coming in. Dr. Ryan Jennings from St. Anthony Memorial Hospital, thank you for coming in today.
It's my pleasure. Thank you, WXEF.
All right, have a great one.
Bye.
All right, have a great one.
Bye.